Now, joining us in the studio, a guy who definitely has his college degree. We have Dr. Frank Lombardo. How you doing today, Doc?
Very good. Thanks for inviting me.
You're very welcome. Now, you're an orthopedic?
Yes, I am.
Are you a surgeon?
I am an orthopedic surgeon.
Now, when you sit there, like when you watch, are you a sports fan at all?
A little bit, yeah.
Now, when you watch sports and you see a guy go down, do you a lot of times kind of know what's wrong with him almost immediately?
Oftentimes, yes. I'm able to analyze the type of injury that they have, the mechanism of the injury, and determine what structure they may have damaged when they fell.
Yeah, because
something that's more intuitive.
The dynamics of the knee.
The anatomy.
Yeah. Now, what about a situation? Now, this is an injury that I've only heard of like in the last 5 years or so, were microfractures.
Right.
Now, what is that?
Well, microfracture is actually a surgical technique that is performed during surgery where we deliberately break the bone to enhance the healing that may occur in and around a cartilage surface. So someone may have some small piece of cartilage damage in their knee, and we punch a small little hole in that cartilage surface that's been damaged.
So a microfracture is a procedure, not the injury?
Not the injury, no.
Now, I never knew that.
You may be talking about stress fractures.
No, like I know, like with Amari Stoudemire,
and
various guys have had microfracture surgery in their knee. I always thought they were having surgery for they had a whole bunch of basically a splintered knee.
No, it's actually the procedure that's being done to help the healing process. So we're stimulating the body to actually heal that cartilage that's been damaged.
Now, do you find that sports have led to a lot of rehab advances, I'm sure.
Absolutely, yeah.
Just last season we saw it with Adrian Peterson. A guy blew out his ACL, an injury that used to be, you look at some of these guys, like Gale Sayers, all right, back in the 1960s.
Yes.
He took an injury that today he'd be back from in 6 months. And it ended his career.
Right. Yeah, that type of career-ending injuries are definitely getting less. We're able to get patients and athletes back to their previous level of function much easier. That was based on surgical techniques and also our physical therapy protocols afterwards.
Yeah, the physical therapy part is really pretty amazing, how they work people back in.
That rapid mobilization where we would protect people for long periods of time, we don't do that as much anymore.
Yeah, because I know back when I was younger, I had a lot of ankle problems, and I would kept blowing out my ankle.
Right, yeah.
And they would constantly immobilize me.
Yeah. Now it's therapy, mobilize, and get all that strength back again.
Get back on those ice skates.
Yeah, that won't be happening.
So the whole microfiber thing, microfracture thing, that's interesting. So it's like, oh no, this thing's not healing, so let's give it something to make it heal.
Yeah.
Let's give it a reason to heal. That's interesting.
And a lot of it's based upon the stem cells. That's a very popular topic right now. But what you're doing during the microfracture technique is that you're getting those stem cells that are from inside the bone marrow to come out to the surface of the cartilage that's been damaged, so those stem cells can actually fix the cartilage itself.
Now, really, so you're basically using your own, because I know that a big thing now is to save umbilical blood.
Yeah.
Because of the stem cells.
Yeah. I've done it for three of my kids.
Now you save it for them?
Yep.
And so, like, if something happens to them,
you hope that the technology's there to actually utilize that, and some of it is.
That's amazing. Every day there's got to be advances and stuff like that that you're reading about and things like that. And just simple things like you do a lot of full joint replacement, right?
I do hip and knee replacement surgery.
And I got a buddy of mine who works here who just had his hip replaced.
Right.
And he was up and walking, I think, inside a day.
Yeah, we try to get patients up walking the same day of surgery, just even within a few hours. Again, that same philosophy of early mobilization. No more of this bed rest, relax and rest. We're going to get people up.
See, that used to be the upside of surgery or something like that. At least I get to hang out in bed for a while.
No more of that.
That's the way I see things. I'm sorry.
Yeah. But how long's that been for? Like, I remember somebody's mother getting a hip replacement. Even feels like it was just maybe 5 years ago, and it was bed rest.
It's definitely been more prevalent in the last 10 years, but I would say probably in the last 5 years, this very aggressive physical therapy protocol has been key to actually getting patients up and moving very quickly. There's even a few centers that are actually getting patients out of the hospital within a day after a joint replacement.
Wow, and it seems like it's younger and younger people getting either that. Maybe it's not younger and younger. Maybe it's just that I'm getting older and older, and more of my contemporaries are needing this kind of thing. Maybe that's what it is.
That's exactly it. We're in the demo now.
Oh man!
Now, when somebody does a hip replacement or a knee replacement,
yes.
Now, how long does it typically last?
The average hip and knee replacements are lasting 20 to 25 years, but that's based upon an estimate that we have through all just mechanical lab testing. A lot of these components that we're using are all new, and they're newly designed, newer materials, so they could potentially last longer in the body than we're testing them for. I like to give patients, and the industry likes to give patients, kind of lower-end results, lower-end numbers, so that if it does last longer, well, fantastic.
And if it's all of a sudden it needs to be replaced, it's like, well, you're inside that window. That's what we told you about.
Yeah.
Right. Yeah, absolutely.
Under promise, over deliver.
Yes. Try.
Yeah.
That's what we try.
Now, what do you guys do now when you take out the bone? What do you do with the bone afterwards?
Usually goes off.
Can you take it home for your dog, or?
It usually goes off to the pathology department. They analyze it. They look for any other problems. There have been a few patients that have actually requested to take it home. One patient actually requested to take it home, and he wanted to do some scrimshaw carving of.
That's the old.
Yeah, I know exactly. Yeah.
That's
I don't know
funny.
how that worked out for him, but he did request.
That's funny.
Well, it is funny.
All right, Dr. Frank Lombardo, our guest in the studio, and you have an event taking place, don't you?
We do.
What's going on?
Dr. Steamer and I are both doing a lecture on total hip and total knee replacement. That's going to be on.
Yeah, close to the microphone there, bro.
That's going to be on Thursday, June 20th at Joseph Tower Auditorium, 40 Reed Place in Poughkeepsie. That's our Vassar Hospital. We encourage people to come down and ask us questions if they're thinking about it, if they have a relative that are thinking about it. Just come down and learn a little bit more.
Well, now, which is easier to recover from, do you think, the knee or the hip?
Hip by far.
Oh, really?
Now, why is that?
Yeah, the hip joint is a much simpler joint. There's a lot more space for swelling to occur, so it's typically a lot less painful for patients to recover from it. Knee replacement surgery is not easy, although it's gotten a lot easier in the last several years. There's been a lot of advances with pain management and physical therapy, but hip is a much easier procedure to recover from.
Really? Because it seems like every time somebody who's when they're 70-something and you go, they broke a hip, and then everybody goes, that's it. That's the beginning of the end.
Yeah, well,
broken hip.
There's a difference in what we're talking about. A hip fracture is a lot different than a patient coming in for an elective hip replacement. When a person breaks their hip, there's a lot of trauma involved in that, and they're often a little deconditioned as well. So patients that are coming in for arthritis in their hip and they're having a hip replacement is a different person than that's coming in to just having a hip repair.
Now that's a ball, and that's a ball joint.
It's a ball joint, yeah, ball and socket.
So now it's a ball and socket. So what happens? You take off you put a new ball on?
Take off the ball, and we resurface the socket. So we put a new implant in there that acts as the acetabulum or the socket of the hip, and the ball is put on as well. And there's different materials.
So you're not replacing the bone that comes out of there.
No. We are replacing the ball portion because the ball portion is removed during the procedure.
So a lot more of your hip remains intact than maybe the layman might think.
Yes, absolutely.
When I think hip replacement, I'm thinking
hip replacement.
Yeah, I'm thinking they got to take both,
everything.
Yeah,
both parts of it.
No, and most of your bone, all of your muscle, all of the tendon still remains in place. So that it's very well maintained. Even more bone is preserved when you have a knee replacement. Most people are very confused when they think they're going to have a knee replacement. They're going to have the femur bone, the tibia bone cut off, and there's going to be new implants put in. It really is a resurfacing procedure in knee replacement. It's a lot like having a cap on your tooth. Just a small portion of bone is removed and a new cap is placed on top of the two bones.
What about the cadaver stuff? My friend had a knee replacement, and I don't know what they got, but they got something from a tendon or something from.
Very, very unique. Not often done.
Really?
That is not a very commonly performed procedure.
Now, have you ever done elbow replacement like the Tommy John or anything like that? Have you ever?
No, that's outside the realm of what I practice regularly. I mostly specialize in hip and knee replacements.
Okay. Well, anyway, if you need to know more about this, Thursday, June 20th, over the Joseph Tower Auditorium on Reed Place in Poughkeepsie. And, I'll tell you, this is one of those things. It does amaze me how many people that I know personally
that
have gone through hip and knee replacement surgery. And if you think you might be a candidate for it, or if you think maybe somebody you know is a candidate for it, you need more information on it, go on down to Vassar on June 20th, the Joseph Tower Auditorium at Reed Place in Poughkeepsie. Their number over there, 877-729-2444. You want to get in touch with the folks. All right, Doc, thanks a lot. I appreciate your time today.
Thanks a lot.